Hello, welcome to another session of the UNTH Health Education Series. Today, I'm going to be talking about cancer, what it is, what it's not, some of the basic things you need to know, and then when you need to see your doctor. My name is Dr. Lasebikan. I'm a consultant clinical and radiation oncologist with the Department of Radiation Medicine here in UNTH. So what is cancer? Cancer in the broadest terms means abnormal growth of cells. These cells keep growing and they don't stop growing, and they keep infiltrating other parts of the body. And it can actually happen anywhere in the body. So you hear us talking about cancer of the breast, which is very common. We also talk about cancer of the cervix. But you can also have cancer of the skin, of the scalp, of the eyes, and indeed, like I said, any part of the body. Who can get cancer? Anybody can get cancer, from a young baby to a very old person. So it's not limited to the young or the old. So it's important that we talk about it and we demystify it so that you know what essentially it is and what it's not. Some people, when they talk about cancer, they say it is something that that's something that's from witchcraft or something that was sent. That is not true. Like I explained before, it is just simply put abnormal growth of cells. There are many trigger factors that can cause it. It's unlike malaria, where we know that a mosquito bite will cause malaria. Cancer, we can't really say that there is a known cause, but they are what we call risk factors. The risk factors can be divided into genetic, which means it's something that is inherited. And then the other part of it can also be something that happens because we live where we live and some of the things that we do when we talk about lifestyle. So in terms of lifestyle, what we eat, how we behave, in the olden days, because a lot of people say these days that we have more cancers now than we had in the olden days. That is true, but we also have to look at how the people of old lived and how we are living today. A lot of people were walking in the olden days. There was no ready access to cars or air travel or very easier modes of transport as we have today. So physical activity actually is protective of cancer, as well as the nutrition. We are eating a lot of refined and processed food these days and less of the natural high fiber foods which are protective of cancer. So we need to go back to the olden day kind of living, where we look at eat well, eat wholesome foods, grains, lots of leafy vegetables, drink plenty of water, and then staying active is also one of the things that can help in preventing or putting cancer at bay. So what else can we do to put cancer at bay? We talk about early detection strategies or screening strategies. So for some of the common cancers, like I mentioned before, breast cancer, there are a few screening strategies that are in place. For a woman, you need to be breast aware, what we call breast awareness. You need to be able to look at your breast every month. Intentionally make out time to look at your breast every month and try to look out for certain changes in your breast. We all know that one is bigger than the other. So we're not talking about just the size. But if the right has always been bigger than the left, and then all of a sudden it's the other way around, you need to see your doctor. Skin changes around the breast, the nipple, instead of pointing out, is now beginning to point in. These are some of the small telltale signs that you as a woman should be able to pick up. Then there's also what you call breast self-examination, where you palpate the breast and essentially what you're doing is checking for lumps. Now, for breast cancer, oftentimes it could present as a lump, but it's important to know that it's not all lumps that are breast cancer lumps. So even though you find a lump, go to the hospital. Do not be afraid. Do not sit on it. Go to the hospital and seek immediate care. Now, other things that you can do is, once you are used to breast self-exam, which you do once a month, then you have the clinical breast exam, which is done by a healthcare professional in the hospital. And we are readily available and willing to do it for you if you come. So that is for breast cancer. What else you can do? You have breast ultrasound and sonomammogram, which is done by the radiology department, and they are very well able and willing to help you get through this procedure so that if you have breast cancer, is detected early. Other things you can do, like cervical cancer, you have what you call pap smear. The colposcopy unit is there and they will do it for you eagerly. Prostate cancer, which is one of the commonest cancers in men, you have the PSA. You go to the lab, they do the test for you, and then if it's high, they tell you, you go to see your doctor with the result, and then they tell you what next to do. Another one that is quite common and is becoming increasing so because of our diet is what you call colorectal cancer. If you are beginning to get plenty of abdominal cramps, or your stool changes in the size and the texture, or there's blood in it, you need to see your doctor, who can recommend either what they call a FITS test, where they try to look for some blood in the stool. If it's there, then they can also tell you to do what is called a colonoscopy. Now, these are things that we can do as people to try to discover it on time. Early detection is the best thing that can help in cancer, because if you leave it till it's too late, then the treatment becomes a little bit troublesome. So that's the much we can take on cancer awareness today. Cancer is a very broad topic, but I leave you with this information. It is not a death sentence. Early detection saves lives. If you've noticed any of these things I've talked about very briefly today, please call the numbers on your screen. We'll be very glad to work with you. Once again, my name is Dr. Lasebikan Nwamaka, clinical and radiation oncologist at the University of Nigeria Teaching Hospital. Thank you.